Okay, everybody, I'm going to kick it off. My name is Rob Noonan. I am the CMO and one of the co-founders of Rialto Markets. I'm going to be your moderator today. We have a slight change on today's webinar. Anna from APISCore was not feeling well. She's sick, hopefully not COVID, and hopefully she's on the mend. But she was unable to join. I apologize for that. In her place, sciences, media, software, and clean tech, using a combination of both equity crowdfunding and institutional investment through international alternative investment tech funds. Second is Joel Steinmetz. He is the COO and another co-founder of Rialto Markets. He has many years experience in financial services on Wall Street. He's helped build trading platforms as well as new businesses at incredible firms like Citibank, Citadel, Instinet, and LiquidNet. Joel recognized the obstacles for issuers and investors in the private markets and saw the opportunity to leverage the Rialto Markets team and their experience to establish Rialto Markets as a leader in innovation within the private securities market, particularly crowdfunding and secondary trading. Last but not least, probably most importantly, is Dr. Manny Villafana. He is the founder and CEO of Medical 21. Manny is known as the living legend of medicine and a true serial entrepreneur. He's founded 7 medtech companies and pioneered major breakthroughs in heart pacemakers and valves, which have already delivered over $50 billion in shareholder returns. $1 million via a Reg A raise to potentially save millions of lives and disrupt a market valued at $10 billion a year. I'm sure Manny will tell you that the market for Medical 21 is larger than both the pacemaker and heart valve markets combined. A little bit of admin. The webinar will be recorded and available on YouTube in a few days. Please feel free to ask questions. If you want a question pointed to someone, feel free. If we don't get to your question, we will try to email you. We have everybody's email and we'll do our best to answer every question that comes in. So let me give you a little bit of background now on crowdfunding globally. In 2020, $8.6 billion was raised in crowdfunding. In 2021, that number jumped 1,021% to 113 billion, and that's from PitchBook. Forbes is reporting that the private securities market is valued at $7 trillion last year and will grow. I'm not sure if we're having a tech problem here, but my screen just got a little funky. Forbes is saying that the private market will grow to 30 trillion in just 8 years, 2030. Currently in the US alone, there's 27 million private companies, but only 1% is traded in the secondary market. It looks like we lost Manny. Let me just, at this point, with private companies, issuers, raising money, secondary trading, et cetera, what would you say is a secret of success for companies, any company, Medical 21, or anyone that is looking to raise capital through equity crowdfunding?
Yeah, so firstly, we need to understand that this is an industry that is really in its infancy. And as such, the statistics are pretty good for what we've seen, but it's not like we have a lot of history, because the real bulk of a lot of these raises has come in the last 2 years. So jury is still out in some manner, shape, or form. But based on what we've seen, there are a couple of really essential points. Number one is if an issuer has a fan base, an existing group of users, customers, or just fans that have been wanting to invest on the retail level, not just on the institutional level, but on the retail level, to be able to go to the crowd. Once having that group of people, there's already someone to target, an important audience to target. A second important factor is to have a digital marketing or retail marketing plan, the strategy in order to make sure that you can attract as many of the retail players as you possibly can. The combination of those two, setting up the retail investment community that already exists in a fan base, plus the marketing to make sure that you can widen that net as much as possible, gives the best chance of success to be able to get that crowdfunding in. So believe in your company. If you believe in your company and you believe that it will resonate, that the message you have resonates with a crowd audience, those are some of the keys to success in this particular area.
Paul, you've been on both sides, the marketing side, the investing side, and the fundraising side. Do you have anything to add to Joel and what really are the keys, in your opinion, to raising money?
I mean, in crowdfunding, it's all about having a simple message with some secret sauce in terms of what your technology does. And I've been reading a lot about what Manny's doing, and there's certainly lots of secret sauce there. But then
Paul Stannard, bottom left, and Manny Villafana, bottom right. I hope that's the same for everybody. Looks like we're having another issue here. Let me go to Manny. Can you hear me okay, Manny?
I can hear you. I'm trying to get on the screen. I'm doing my best to try to get back on the screen. And can you see me at all?
We can see you.
You can see me.
I think you clicked on something, so the background's different, but that's okay. We want to hear from you. Most importantly.
All right. Then let's start all over, because I'm sorry. I've been trying to work my computer, and I just
maybe Andrea can help
something.
you. I think what you want to do is maximize.
That's what I'm trying to do, and I maximize, and this is what I get. But if you can see me, I can see you. Ignore my background.
Yep. I can see you, and I can see the questions coming in, so that's good. So tell me, Manny, just tell me about yourself. It's hard to know where to start with you. You've had so many successful startups. It's really, really impressive. So what motivates you? What motivates you to innovate? And it's just amazing how many lives you've saved, and in the process making $50 billion in investment value. So maybe just talk a little bit about your background, what motivates you, and then what Medical 21 is doing, and what you're looking to accomplish.
Well, again, Rob and our audience, I sincerely apologize for the technical problem that we're having, but I will try to speak and let you know what we're doing. First of all, my background starts in the South Bronx of New York. I grew up in it was the poorest congressional district of our country, but that's not the important part. The important part was that my entire family died of heart disease. My mother, father, and 3 brothers all died of a heart attack. Okay. So I have an inherent encouragement to get into this field. I started in this field when, at the age of about 21, 22 years old, I joined a company called Picker International, which was the export agent of a little teeny weeny little company called Medtronic, whose sales were less than $1 million a year. And of course, today, Medtronic Inc. is the world's largest medical device company. At the time, the largest X-ray company had throughout the world. We were successful in introducing that pacemaker. However, 3 years later, Medtronic, that is Earl Bakken, the president of Medtronic at that time, plus together with a guy named Charlie Cudahy, approached me, and they came up to New York and said, Manny, we would like to hire you. We want to get closer to our customers, our doctors, and we would like to hire you and terminate the relationship that we had with Picker. I accepted that offer, even though there was no money or contracts offered to me. And everybody said, Manny, what are you, crazy? Why did you do that? And I said, look, it was a chance to get out of the Bronx. I mean, if you ever lived in the Bronx, you want to get out of the Bronx, okay? At that time, it was a pretty rough situation, so I took that advantage. Upon arriving at Medtronic, almost instantaneously, about a year later, I convinced them that we have to open up a facility in Latin America, because Latin America was, in fact, the largest potential market of the whole world for pacemakers. Annie, why? Are you kidding me? Why? There's no money down there, et cetera. Yes, but there was a bug that looked like a cockroach called a vinchuca that was infiltrating the homes of families, and in their small little children would infest a child to the fact that by the age of 17, 18, 19, that child would end up with heart block, and in other words, would need a pacemaker. So the market was potentially large. In fact, in Brazil at one time, it was called a 10% disease, because meaning 10% of the population of that country already had the vinchuca virus in their body. Anyway, during that period of time, I finally convinced them, let me go to South America and see what we can do. And I went to South America, and in a short period of time, about 2 years, we were able to establish a market, et cetera. But the pacemaker was failing terribly. The average pacemaker, which was size of a hockey puck, was lasting 12 to 18 months. You can't continue to do business like that. So when I came back, I met with an inventor who was developing a new power source. And I went to Medtronic and said, why don't we make a pacemaker incorporating this new power source? They said, no, Manny, it can't be done. I said, well, I'm going to give it a try. And they showed me where the door was, and I went out the door. And I started a company called CPI, Cardiac Pacemakers, Inc. And we established and developed pacemakers that I said would last 10 years. That was our goal. I mean, everybody was saying that was impossible. So we started a company called CPI. We developed the first hermetically sealed pacemaker incorporating a lithium power source. And that pacemaker became the standard of the world today. Every single pacemaker of the world today, made by a variety of manufacturers, all incorporate the basics of the first CPI pacemaker.
Let me interrupt you for a second, Manny, just because I think an interesting question came through, and I really want to hear about the current offering. And it seems like what's amazing to me is all of your past endeavors have just, as if I say this wrong, no name wrong, Dijon Harris. Are there plans or strategy to encourage families who have been affected by heart disease? Oh, of course, my screen just moved. The question is off the screen now. We have a lot of tech problems today. So are you targeting new families that have heart disease in their family and have to go through these operations? And why is it your product so good? And like I said, especially when we talked the other day, all the peripheral things, like you're up on your feet and you're walking sooner and stuff like that. So can you talk about the product and not just what it does to save your life, but really to make your life better in the immediate future after the operation?
Well, let me just touch base on three basic products that we have done. First of all, the pacemaker. We went from a hockey puck size lasting 12 to 18 months to a pacemaker about the size of a couple of quarters put together, or about the size of a watch to put into the body and last 10, 15, 20 years or more. Okay, that alone eliminated this operation every 12 to 18 months. Then we went to heart valves, and heart valves again was a situation where we developed the St. Jude heart valve that would last the lifetime of the patient, that would create less work. And so therefore that patient would not only get back to work or back to his or her life, but also with less risk of strokes and clogging up and things like that. So that the St. Jude valve became the most commonly used prosthesis in the world. Okay, there are about 4 or 5 million people doing that. In fact, we later on, about 15, 20 years later, we improved on that heart valve and developed the ATS valve, which is now owned by Medtronic. So we improved the life of a patient receiving a heart valve so that he or she could lead a more normal life, less fear of stroke, less fear of clogging up, etc. And the work that we're doing now, however, is in the field of bypass surgery. The patient has chest pain because his vessels on his heart are clogged up. The typical patient who now has heart block has to have a surgery called CABG, C-A-B-G, and they have to open up the legs and arms of his body, and even go to the breast of the patient to remove vessels put on the heart. That's major surgery. Takes major time. And what we're trying to do is develop an artificial artery. We have developed that. We are now in the process of meeting with the major centers of our country to begin a process of evaluating this device in humans. This week alone, I will be visiting one of the major centers of our country to discuss the possibility of their group studying this device in a few initial patients before we go into a formal study. So these are some of the benefits that we're doing. And of course, what's interesting is that per year. So it's a market that's at least 45, 50 times larger than what it was when we started St. Jude Medical.
This is a question that's being asked of Manny, but I'd like to hear. I think I'd like to give Manny a break and hear from Joel a little bit and from Manny as well. But do you think that this crowdfunding will attract retail investors, the man on the street, as well as larger or accredited and institutional investors? And Joel, maybe you can touch upon how we tackle the more accredited and institutional investor.
Yeah. So just from a general perspective, the companies that are successful actually get it from both places. If you're looking to raise, 20, 30, 40, $50 million through Reg A, having that just done through retail is going to be a tall task. But if you can subsidize it or supplement it with some real attraction from the institutional or the accredited investor universe, that will meet with success. The key to be able to do that, now there are different messages for the issuer, right? There are different messages that go to the retail investor than those that go to the institutional investor. But ultimately, and this is what we speak to issuers about, ultimately it's about the story. Is it a good story? Is it something that resonates with retail investors who are looking to get involved in something that they want to vote with their heart or their legs or whatever you want to call it, but really get involved in something that's meaningful to them, aside from being able to deliver some financial benefit. Whereas institutional investors are really going to be looking much more from the financial perspective and how it's going to impact their investment universe and their investment portfolio. That doesn't mean that one company cannot attract both of those. They can. But maybe Paul can weigh in on this. There needs to be a dual message that comes together ultimately at the story. Is it a good company? Is it a good story? It might be a different message delivered to institutions versus retail, but we still need to figure out, is the story a legitimate story that attracts both sides? If it is, that will get you the success of 30, 40, $50 million raise.
Yeah. I couldn't agree more with that. Now, obviously, Manny's done so many things in a career, and delivering 57 billion in shareholder value is just beyond comprehension. But you still got to understand what today's proposition is. So, in today's, what he said earlier, you've got an artificial heart graft that basically is going to, what I'm reading is, that's going to stop people having these complications. So if you're a diabetic, you can't, you can't maybe have some of this treatment, or you maybe get infections. And the challenge for the academics and the people that have is making sure that they keep the message simple, because it doesn't matter whether they're institutional investors or retail investors. They want to be able to know that they understand it, and if it gets too far down into the jargon, then sometimes you do, unfortunately, that you lose the audience. And sometimes, not the greatest ideas get the money. People who actually can explain their story in a much more succinct manner, and I think that's key of what I've seen, is keep it simple. And be consistent in terms of your message, and then you can build on a community. I can't imagine, in terms of what Manny's going to do with his track record and the fact that he's done it again and again and again. But they've got to still under
the proposition of raising from the general public and giving them an opportunity to get in on the ground floor.
Well, again, you got to remember that I've done 7 IPOs in the past history. Okay, this is our 8th effort. Now, when we started this technology, please remember that no one's been able to do this. People have tried for 50 years to develop an artificial artery so that we don't have to take vessels from various parts of the body. And I'm going to do something that I don't even know if it's going to work. But I'm going to show you the type of surgery that is involved of removing a vessel from your leg to go onto your heart. That's major surgery, okay? And imagine doing that on both of your legs and then on your arm as well in 23% of the patients. That's gruesome. So I'm just trying to develop a method to eliminate that surgery. Now, people have tried. No one has done it. So we embarked on it with new ideas, new materials, etc. And it has taken us a long time. It's taken us 6 years. All right. Now, during that period of time, like former companies that I have formed, we go to private investors. We ask them, please support what we're trying to do now. And everybody said, well, Manny, you've done these things. Sure, we'll help you. At a point where we're ready to do human implants. However, trying to do an IPO these days requires that you have revenues. We still do not have revenues. Why? Because it's taken us a long time to develop this. Simultaneously, the people at Rialto have come to us and said, look, the Jobs Act allows us to now approach both accredited and non-accredited investors to be able to help you fund this type of technology. We reviewed everything and we decided that with the help of Rialto that we approach a 21st century type of financing. Not like before, it's different, okay? And as a result, we've done a cooperation with everyone involved, and we are now doing a Reg A, and we have gone effective with it, and we're now trying to raise approximately $40 million to handle the continuous work that we have to do. The work of R&D is going to be less, but now we enter the phase of all the regulatory requirements and getting such a device approved, not only here, but in other countries throughout the world. we've gone through this before, but this time we're going through it with a Reg A financing rather than IPO financing. We can't do an IPO financing. All right. So as a result, by doing it this way, the average individual can participate as well. He or she can invest, $150, $500, 1,000, 10,000, 50,000, whatever number he or she would like to invest, and we can do it relatively easy using the method of the Reg A plus financing that we're presently doing. Life creates the hardening of the arteries, which will need to be bypassed. So you're going to do it my way, guys. And don't worry, I'll get you a discount if you're one of my customers, okay? All kidding aside, this is what it is. And this is why we're using the Reg A financing. It gives us the opportunity to let the average individual participate in in my opinion, the biggest technology ever developed to put something inside the body.
So Rob, do you mind if I pose a question? Because I've been around the whole sort of med tech and life science space through the funds, and one of the questions do you mind if I pose a question to Manny?
Yes, please.
Because obviously, people, when you're dealing with life sciences or medical devices, it's a long road, and you said 6 years, but they're investing really in it, even after 6 years, and probably many years of thought before that. Are they investing now in basically the final stage, the human trial stage, where you've done all the animal trials and they're investing in the final part before commercialization? Is that right?
Yes, and bear in mind that in all of my companies, all right, like I said, I've done 7 IPOs before. They would invest in various stages of our development and recognize that what we're doing is something that is needed and something that was quite enormous markets. I mean, in all of my companies, we went private, then we went public, and then we were taken out by a major company. At the door, somebody knocking at the door earlier than we have done in the past. Why? Because this is the single biggest product ever developed to be put inside the human body. Okay? 2.5 to 3.5 million grafts per year. And now that we make it in such a way that it's much easier for a doctor to implant it, that number will grow in spite of the fact if the market doesn't grow. The number will grow because we have it so much easier where a doctor can do 2 or 3 cases instead of 1 case per day, can do 2 or 3 cases because it takes so much less time, less surgery, less costs, etc. So
I'll put my regulatory hat on, and Joel might too. Yes, you never know when an acquisition is going to come. It's impossible to say, and an investment in Manny's company, you just never know. It's impossible. You
right.
to say that.
Yeah,
but just to touch on 2 of the differences really in the Reg A offering and going to that retail investor, 2 important things to keep in mind. Number one, it's allowing retail investors or Manny refers to him as Joe the bartender very often, just people who have been impacted by these things. And to Manny's point earlier, everyone knows someone or is related to someone who is impacted by heart disease. And so it sort of allows retail investors to invest with their feet. That's really the emotional side. But then from the ability to go after those private markets and not the retail investor, Reg A allows the retail investor to get involved in whatever level they can within the private market, so that the growth and the financial benefit that exists throughout the lifetime of the company is able to be taken advantage of by retail investors at the earliest stages. And so there are both emotional and financial reasons why this type of raise works better or worse, I'm not going to say, but in a different capacity than the normal ways of financing.
Yeah, Joel, it's interesting that you say that. I was going to ask this question a couple questions from now, but Charles Jordan has two interesting questions. One is, do you find it harder to explain a more tech slash scientific proposition to investors? And I'll just add before you, and I'd like to hear from Paul, we all invest in Apple. I'm not sure I can explain how this works. So, you know, it's really
Yeah,
about the story.
but the message of that was they made it sexy. They made you feel like you had an accessory. It was like a handbag. So that was, they kept it simple. And actually, in the end, the technology just become a by part of the brand. Now, Manny's is very different. You know, we're talking about people's lives. I was on a call with somebody just before this, who I was telling him I was going on this event, and he was saying, "Oh, my father couldn't have. He had a heart bypass, but it went wrong, and they got sepsis, and he lost his limbs. And I'm sure, I don't know, but I'm sure, you know, everybody will have their story, and this capital this way. You've got to have a message that track record, yes, is unbelievably important, but you've got to keep your message simple." So yeah, sorry.
Yeah, it's been my experience that people invest in our companies because of management, the company's mission, and for personal reasons. You know, everybody knows somebody that's had this problem. Everybody might like to help the environment. There's lots of different reasons.
Yeah, may I add an additional
Yeah,
thing?
please do.
You know, again, the average investor who may be listening to this webinar, and the average investor who wants to get into anything, I don't care if it's high tech or med tech or groceries or cars, electric vehicles, or something like that, all want to say, look, I'm going to invest with the hope that that investment will grow faster than the rate of inflation, et cetera, et cetera. Okay, that is the basic goal of investing. Okay, I think that one way of answering the question is really to answer the question of investing rather than technology. If you take a look at, let's take the world of electric cars. Every one of our listeners, viewers here, all heard of Tesla. Recently, with the help of one of my staff members, I said, what would happen if I had put in $1 million into the IPO of Tesla, the initial public offering of Tesla? What would it be worth today? And the answer came back somewhere between 200 and 300, not all the way through, but in the same amount of time of the IPO of Tesla to where it is today, some 12, 13, 14 years. I don't know the exact number. But in that same period of time, the $1 million that you put into St. Jude would have been worth somewhere between $1.5 and $2 billion. So what I'm trying to say, we did like 6 or 7 times better than what Tesla had done. Okay? Not bad either. Okay?
Yeah.
And if you think that was a good number, if you would do the same exact math when we did CPI, Cardiac Pacemakers Inc., it was even better than St. Jude. The point is this. We are working in markets that are silent. That is, we carry them with us all the time. We have our heart valves open and close. Our pacemakers stimulate our heart to keep it going. But the market is truly, truly enormous. And this is bigger than all the pacemakers, all the heart valves, all the defibrillators combined. Okay? So is that more interested in talking about what we're really trying to do of creating an artificial graft for a heart? I hope that's interesting. Now, I don't think it's as interesting as actually doing what we're doing. You know, that's so much fun. I mean, one of the original questions is, no one has ever done that. Everyone says you're out of your mind, man. You're crazy. When I was doing CPI, the pacemaker, one of my friends came up and he said, Manny, I don't know what you're drinking, but give me a couple of cases of it. It must be really good stuff, okay? Because I was going after things people say can't be done. And it is an amazing event to be able to do that. Believe me, much better than playing golf.
Yeah.
Keeps me going.
Just to step in, because I know Manny wants to say this, but past performance is no indication of future results.
Yeah,
particularly when dealing with different companies. But the point that Manny is explaining is these are the excitements that can be raised through an opportunity that saves lives.
Yeah.
No doubt about it that the risk of doing these things is always present, and we have to, like any investment, evaluate the risk and the potential benefits and everything. But the only way I can describe the potential benefit is to give you examples from my past. Okay? Yes, I've had strikeouts. The guy named Mickey Mantle, if you ever follow baseball, okay, New York Yankee, superstar, seven World Series rings on his hand and stuff like that. All right? He also held the record for the most strikeouts. But he went on to become the greatest player because he kept swinging the bat. Now, I swing the bat every single day, okay? And if you're asking about Manny Villafana, he's a guy that gets up in the morning, grew up in the...
Yes, Jim, the numbers were pulled from PitchBook. I would assume that they are global numbers, but it is from a reputable source. But good to hear from you, and thank you for joining. Joel, the other question from Charles Jordan is, does the SEC or someone have best practices around crowdfunding? It would be useful to have a resource like a guidebook or a reference when starting out on a raise. Maybe you can talk about that, talk about resources that we have on Rialto, et cetera.
Sure. So the simple answer is yes. There are some very clear guidelines, rules and regulations, processes and procedures going about any crowdfunding, whether that's Reg A, what we're talking about today, or Reg CF, which is a different, smaller type of crowdfunding. All of those have regulatory oversight, and anyone involved in that has some very strict rules that have to be adhered to for investor protection. The idea of an issuer and what an issuer needs to do, and the processes and procedure that need to be done, certainly please contact us at Rialto. Rialto has sort of those what to expect, what we call it a what to expect guideline, just so you know what you should expect as you're going through the process, what the stages might be, what the procedures need to provide of what to expect. So there are, I think you're 100% right, and my suggestion would be to any issuer that before embarking on this is to get a clear understanding of what it actually is going to take and how long it's going to take, at least some approximate idea of how long it'll take, what the costs would be, and what the resources are needed in order to make it successful.
Can I add one part?
Yes, please.
And that is this. The investor should know that when we were preparing all of this, we had to file with the SEC necessary documents, also with FINRA necessary documents. Everything is followed by attorneys that are independent from me, but become the law, the legally modifications that we have to make, all the legal steps that we have to take, they monitor. And then we make it as simple as possible for an investor to get in. He goes to the website, he or she goes to the website, reads all the material, there's everything on there that you could possibly think. And then if he or she feels comfortable, you hit one little red button, you fill out your form. You can even do it on your credit card. Use your credit card to buy. I always say if you put enough money in, you get a lot of points, and the easiest possible way.
Yeah,
that's the key. Is this is the raise? These raises are 21st century raises, so they leverage technology And although there are multiple component parts that need to be integrated, whether it's a broker-dealer or banks or escrow agents or lawyers, marketing teams, etc., all of that can be coordinated into a single technology so that whatever is happening under the hood, behind the scenes, is invisible to the investor and, for that matter, the issuer, simply because there's a button that is hit and the investor just says, sure, I'm interested in investing in whatever the stock might be, whatever the Reg A might be. And then all those other things are going on behind the scenes so that the investor ultimately can get back one of two messages, either congratulations, you are the proud owner, or here is the reason why it wasn't accepted for whatever things that might have to either be fixed or cannot be fixed potentially, in order to make sure that everything is run very smoothly for a very easy experience for the investor.
Joel, I'd like to ask you the last question coming in, and then I'm going to open it up to the three of you for last comment, and then I'm going to give my summary, my closing remarks. But it does have to do with what you all are talking about right now, and it's from Chris Sorensen. Our institutional investors welcome, in addition to retail investors, even if encapsulated in their own investment vehicle. So maybe you can talk about that for a quick second.
Yeah, so involved right away gives you that from the start. It's really, again, is the deal they want to get into. And like we said earlier, institutions might be looking for something that's different than retail. And, someone like Paul or any of those marketing type of players are going to have to target those two audiences differently. But if the message is still, this is a good company, and this is a worthwhile investment, there certainly is no fear of the institutional investors getting involved in the retail. Now, what some people sometimes worry about is, well, it confuses the cap table, et cetera. If you look at what I'd call modern day cap table management companies, they can handle 10,000 investors as easy as they can handle 10. It's all done technologically, whether it's through blockchain or some other means that enables them to really manage all of those investors quite the same as if they would manage a few investors. So as long as the cap table is understood, easy to manage, visible, and transparent enough for institutional investors to get comfortable, they'll continue to get involved in these kind of investments.
Yeah, I couldn't agree with that more in terms of what Joel's just said, because without naming the company, but we were working with a company recently that was predominantly getting retail investors, angels and smaller accredited investors. And in the last 4 or 5 months, now they're getting big name, huge institutional investors, and they're not worried about the cap table. They've got, thousands and thousands of small investors, but they're now, because of the noise around that company and because of the positioning that the crowdfunding has done for their business wider than just the capital raising, these companies are interested because they've actually market made, not just raised capital, but they've market made their position in their marketplace, which is making them even more attractive to those institutions.
That everyone understands that we have reached the phase in our development in which we are ready to begin talking to the major institutions of our country to begin doing some human implants. We have already met with a couple of the major players, and bear in mind that even one of our players is a partner of the company, that is the Mayo Clinic, has already signed up to be one of our clinical implanters. They want to participate. Next week, I will be meeting with them to begin giving them the paperwork that they need to begin looking for patients that might be able to benefit from our device. We feel, as always, that we will continue to use the methods that we have done in the past, the distribution methods of independent representatives throughout the world. We've done that in the past. We have already started building a new facility to add to our present facility, because the market is so big that we want to be able to immediately begin building enough product to be able to handle the potential of this market. This financing that we're doing now will allow us to grow for quite some time, but hopefully to the time when we can be generating our own revenues. There is a method on that website to ask any questions that you have, and we'd be happy to answer your questions.
Joel?
Yeah, I just want to end with the idea of doing this in a new way and financing through these kind of crowdfunding ideas, and some combination of accredited investors and non-accredited investors, allowing issuers to spread the net as wide as possible. Manny's company is a good example of one that's trying it in that particular industry. We touched earlier upon some of the needs or potential success factors in any industry. And just I think it's important for issuers to keep in mind that, or keep an open mind at exploring what kind of funding they can do in these ways of performing that kind of capital raise, and at least check and do the due diligence to see if it might fit from a financial perspective and a capital raise as well as a cost, and see if it works well for your company.
Paul?
Yeah, and I just sort of step on that from what Joel was saying. You know, I think this is the most exciting time ever for private investors. Whilst there's huge amounts of risk out there, you know, the opportunities to create impact, the opportunities to be able to invest in the next SpaceX or whatever wasn't there for people, because the VCs had control of it all and were putting the founders in difficult positions and controlling the whole process. For the first time, now everybody has that chance. They've got to take all their due diligence. They've got to do all of the right things, and they've got to have a balanced portfolio and all that stuff. But this is an exciting time to support, you know, great private companies that basically can have a real impact.
Okay, I think we're going to wrap it up. I want to give a thanks to the panelists. A big thanks to Paul for stepping in the last minute. Your advice is always outstanding. Manny, it's always a pleasure speaking with you. I enjoy every minute of it. If you want to get in touch with Manny for an investment, you can go to Medical21. That's with a 2 and a 1, medical21.com. He also has such an enormous following that you can go to investinmanny.com and it'll take you to the same place. It's just a little bit easier to remember. Apis Corp, again, was not able to be here. I apologize if you tuned in to see them, but their website is apis, APIS-core.com. You can always go to rialtomarkets.com to ask questions. In the coming weeks, we're going to have tombstones for all of our live issuers, so you'll be able to get to them that way as well. We had amazing questions, too many questions. I wish we could have gotten to them all, but we couldn't. We will do our best to get to you. We also had quite a few issuers asking questions. We will do the same. We will reach out to you. We will set up meetings to explain how we can help you. I love talking to new issuers. Again, this will be on our YouTube channel.